you're here for your cranial nerve examination, is that right? Alright, let me just grab my notes. Okay, try not to worry or stress. We want this to be nice and relaxed, okay? Alright, can you just confirm your name for me? Okay. And your date of birth? Alright. Now, can I just check with you why you're here today? What happened? I see. I'm sorry to hear that. Okay, I did have this down in the notes, so I just wanted to check that it was right. Okay. And how are you feeling today? Your head's still a bit sore. Okay. Maybe you had somebody have a look at your head already. Good. Good. Okay. And then, right. Can I just confirm your medical history? Is that ongoing? Okay. And are you on any medications at this moment in time? Okay. Anything else? Apologies, I believe there is a dog at the door. Okay. So, okay. Alright, and is there anything else you think that I need to know at this time? No. Okay. Okay. Right, well, I'm going to take your heart rate. Just have a quick listen to your heart. I like to do that at the start of all of our cranial nerve exams, okay? Just to make sure there's nothing there that's a cause for concern. Alright. That's it. So I'm just going to lift your top up ever so slightly, okay? And I'm just placing the stethoscope on your heart now. I'm just gonna have a listen, okay? Okay, that sounds perfectly fine to me. Yeah, of course. Alright, so we're going to begin today with your scent tests. So I actually have a variety of aromatherapy oils today. So I'm going to pick 5 different oils for you to smell. They'll be of a different category. So even if you don't know what it is, that's okay, but you should be able to describe it for me. So it might be floral, it might be musky, perhaps it's even herby, just anything at all. Just describe what you smell, or if you recognize the scent, let me know what you think it is. Does that make sense? Wonderful. Okay. So the first one we're gonna do is this one here. I just make sure first that the scent is correct, okay? Just gonna gently breathe in and out. Okay. What do you think that one is? Okay, it's good. It's eucalyptus. So that's how you'll be able to smell that kind of medicine, deep heat style scent. Great. Okay, our next one. And you recognize that scent. Of course, it is indeed tea tree oil. You'll often smell it in skincare products that target spots. Alright, our next one. Yes, it is indeed. It's very sweet. It is vanilla. That's great that you picked that up. Okay. Our next one. It's familiar. It is a flower. Can you guess which one? It is indeed. It's quite a distinguishable scent. Rose. Very good. I'm actually just going to do a couple more, okay? So this one is lemon. It's actually lemongrass. Indeed. Okay. And our final one is this. Just, if you don't know what it is, just describe what you can smell. Okay. It's muskier. It is indeed. But you're not sure what it is, that's okay. So this one is sandalwood. And it is a muskier scent, but I wanted to get you to smell that just to make sure that you could get that okay. So I'm just going to note this down. Okay. So smell was wonderful. Indeed. Okay, let's move on to your eye test now. Okay, have you had any issues with your That's not a problem. Well, we will begin with our Snellen chart, okay? So I'm just going to hold this here for you, alright? Okay, I just want you to read the letters for me, beginning with the top. So C, H, S, Z, N, D. K, C, R, H, N. Next. Z, K, D, B, C, O. That last letter is just a little bit tricky. The next line. H, V, O, R, K, Z, S. Then we have R, H, S, O, D, C, B. And then, that's K, S, V, R. And then the final one is H, N, Z, C, D, K, R. Okay, great. That was good. Alright. So we're gonna move on to your colorblind test as well. Okay, so I'm going to show you some different colors. And you need to tell me if you see a letter, a number, or a shape. Okay. The first one. This is the number 09. Okay. This one. Alright. 25. This one. 4. This is the letter E. This is a lightning bolt shape. And that was a cross. Well done. I'm just gonna have a quick look at your eyes now just to check how your pupils react to the light. So if you just look directly at me, please. Okay, you look up for me. Look down. Okay, look to your right. Look to your left. Okay, look up for cover this eye, I want you to look straight ahead here. Okay, my nose. And then I want you to tell me when you see my fingers in your peripheral vision, okay? So I'm just covering this eye. Okay, and the other eye. Cover this eye. Okay, same thing. Okay, very good. Alright, I want you to look at this finger. I just want you to follow this all the way into your nose. And out again. And into your nose. And out again. And into your nose. And out again. Cool. Okay, so no issue. Alright. Now for your ear and hearing test. I'm going to begin by using a device as a tuning fork. 3 times I'm going to sound it in and around your ears, and I need you to tell me when you can no longer hear it. Okay. And if obviously you can't hear it at all at that frequency, you let me know. Excellent. Okay. Now I'm going to do the distraction test. So I'm going to make a sound in one of your ears, and I'm going to whisper things in your other. And you need to repeat the words that I whisper. Okay. Sandwich. Cup of tea. Dolly. Jingle. Okay, and we're going to do the same on the other ear. Pineapple. Measuring. Camera. Shortbread. Picture frame. Teacup. Great. Well done by repeating those all back to me. I'm just looking at this now, and I think that the ear test was a success. So we're now going to move on to your touch test. So here we're going to test the nerves responsible for touch on your face, your skin, so mainly your face and your neck. Okay, and one is the kind of sensory pathway and the other is the pain pathway. But don't worry, we're not actually causing any pain. So we have something super soft and we have something a little bit more sharp. But as you can see, it's not sore, but it should invoke that pathway. So we'll begin with the soft. You just need to let me know every time you feel it. Okay, and if you can't feel it, then I will prompt you again. And if you still can't feel it, then we will have a closer look at that section. Okay. And the way that it feels circles into your neck. And onto our sharp. Alright, great. You did really well with the touch test. So our final test is the movement test. So I'm just going to perform a series of manipulations and movement requests on you. So I'm going to put my hands on your I want you to turn your head to the right against my hand, okay? Okay. Same on the left side. Okay. And put my hands on your cheeks. I want you to try and blow them out. So, like this, against my pressure. That's it. I'm just going to check your reflex as well. I'm just going to hit below your knee. Okay, on both sides. So, one. Good. And this one. Perfect. I want you to swing your jaw from side to side like this. Good. Can you scrunch your eyes shut? Okay, raise your eyebrows. Give me a big smile. Okay, and then open your mouth and stick your tongue out for me. I'm just gonna look at your tongue. Check for any signs of wastage. It's fine. Can you move your tongue side to side? Like that. Excellent, excellent. Well, I'm happy to sign you off because you have passed all of those tests with flying colors. Are you feeling a little bit more relieved and happy? Excellent. Excellent, excellent. Okay, well, if you have any other concerns, if anything changes, such as visual disturbances, sore heads, you feel nauseous, do let us know right away. But aside from that, I think your cranial nerves are in perfect working order. Alright, well, thank you for coming to visit me today, and I will see you again